Okay, so today's video is going to talk a little bit about lower back pain and specifically our deep stabilising core stability muscles. Back pain's a really common problem, and unfortunately statistics show us that if you've had an episode of back pain, 80% of people will go on to subsequent episodes in the future. So it's really important that we can try and show you exercises to be able to help to strengthen and stabilise and support your lower back. Now, you'll hear people talk about core stability and core strength has been really important, and that's absolutely right, it is. Whenever we have pain, it can switch off our core stabilising muscles, and these are deep muscles that should be working the whole time, whether we're getting in and out of the car, carrying the shopping, going to the gym, rolling over in bed at night. These deep muscles should be working at a nice low level constantly to support our lower back. Now, if we have pain, then those muscles can get switched off, they can be inhibited. And unfortunately, the way that the body often works is that when that pain subsequently finishes, those muscles don't necessarily switch back on. And what can then happen is that our bigger, more global muscles that are designed to move us rather than support us start to take on a supporting role to hold us. And that's where problems longer term can start to creep in, because those muscles are just not designed to do that job. So in terms of what those muscles are, we've got different layers of abdominals. So we've got our six-pack muscles that run straight down the front, our rectus abdominis. We've then got oblique muscles that run in this direction. Then deeper still, we've got obliques that run in this direction. And then deepest still, closest to our spine, we've got transverse abdominis that runs all the way around. Now, transverse abdominis links with our diaphragm muscle, so our breathing muscle. It links with our pelvic floor, so the muscles underneath. And it also links with little muscles called multifidus, which run over the different layers of our back. And together we call those muscles our cylinder of stability. Okay, they're our deep, true core stabilising muscles.
So, in order to engage and be able to show where these deep tummy muscles are, those transverse abdominis muscles, we're going to lay into this position. So flat on our back, knees are bent up, so our feet are hip width apart. So we've got feet, knees, hips, shoulders, all parallel. Okay, so almost like we've got train tracks running through us into here. Now, in order to be able to feel, to know that these transverse abdominis muscles are activating and working, we need to get hands on to be able to feel them. So what I'm going to do is I'm going to feel the bony part of my pelvis at the front here. I'm going to go 2 centimetres in and 2 centimetres down. And I'm going to just rest the heels of my hand across my pelvis and press my fingers into the tissues here. What I'm going to do is a little bit of a cough and I'm going to feel that those muscles tighten and tense underneath my fingers here. Now, what I'm going to do is everything else is going to remain nice and relaxed. I'm just going to breathe nice and normally, and I'm going to see, can I engage those muscles underneath my fingers? Can I feel them tightening up underneath my fingers? By having my fingers on onto there, I can increase the proprioception, so I can feel with my fingers and tell my brain that yes, that's it, those are those muscles working, or no, there's nothing working into there, got to work a little bit harder. Sometimes this can be quite tricky, so you can sometimes find that doing a pelvic floor contraction, so imagining that you need to go for a wee and you need to stop halfway through, that can bring on that activation of those deep tummy muscles. What often happens is that people will tense, so you'll feel this full abdominal bracing into here to get those deeper tummy muscles working. To begin with, it's okay if that happens. What you need to do is then be able to relax the upper muscles and keep those deeper lower muscles working, those transverse abdominis. Once we've got that, we're going to aim to breathe in and out 10 breaths, 10 times. So it's quite a long, slow hold. Everything's nice and relaxed, just breathing normally, but engaging those muscles for that period of time. Once you can manage to do that, so you're starting to get a little bit of control, what you can also then do is to practice the level of the contraction that you can get. So you can go from a nice steady level to, okay, I'm going to bring that muscle on, contract it harder, up to 100%. I can take it down to 50, I can take it down to 25, back up to 50, back up to 100%. These muscles want to be working at between sort of 20 and 30%. Remember, they're postural muscles, so we want them to be able to work the whole time. Okay, once we've got that control and you're feeling comfortable with that, we can progress and start to challenge the muscles a little bit more. So again, we're feeling that pelvis bone, 2 centimetres in, 2 centimetres down. Rest the heels of your hands across your pelvis into here. So everything's nice and relaxed in this position. We're going to engage the muscles, breathing nice and normally. We're going to aim to just gently roll one knee out to the side and bringing it back up to the centre. We're going to then switch, roll the other knee out to the side and back to the centre. Now what wants to happen if those muscles aren't working very well is that the static leg, this leg, wants to wobble out to the side. Really important that we've got to keep that one nice and still, and this one goes nice and smoothly. It's not about how far it goes, it's about how much control you can keep with these muscles switched on. These muscles should feel nice and equal. The contraction underneath your fingers should be tightened equally both sides. As you come out to the edge, you might find that, oh, it drops away. So feel as though that you lose a level of contraction as it comes in into here. So that's where you've got to practice and concentrate and work hard to keep that contraction nice and steady all the way through the movement. When you can manage that one, we can then progress and think, okay, what happens when I switch the legs up and over? As I go in between one, does my pelvis want to rock from side to side? Does it want to collapse and twist? If it does, that's where your hands feel it. Think, okay, I've got to work those muscles harder to keep nice and steady as I bring my shin up to level with the floor, to parallel, and switch and into here. I can then progress the third exercise from that same starting position, engaging those muscles. I'm going to slide one foot out along the floor and slide it back in. Again, the tricky part is that transition between the sides. When you get to the end, those muscles and pelvis might want to drop off to the side. So that's where you've got to work hard and draw back into that position. Aim to try and do 10 sets on each side of each of those exercises once you've progressed through those layers.